In this video, you will learn the top 5 HIPAA violations and how to train your staff to avoid them so you can put your private practice on autopilot. Hello, my name is Liz. Don't forget to hit the like button and subscribe to my channel so that you can get notifications of new content. Hi, everyone. Today we are diving into one of the most important topics in healthcare compliance. HIPAA violations. If you've been in healthcare for even 10 minutes, you have heard the word HIPAA. Even a small mistake can lead to serious consequences, from fines to losing patients' trust to even having your clinic closed down. So let's go over the top 5 most common HIPAA violations and what can be done to avoid them. Starting with number 1, unauthorized access to patient information. This violation happens when someone looks at a patient record without a valid reason to do so. Sometimes it's out of curiosity, but even a casual glance is a huge no-no. For example, if you work in a hospital and your sister is admitted to the hospital and your sister is being treated for something, if you are not directly on her care team, you are not allowed to pull up her records, read her records, and look at her records. That's a big no-no. Every patient's information is protected, and it's essential that employees understand their access limits. Unauthorized access is one of the top reasons healthcare organizations face HIPAA fines. So remember, if it's not necessary for your work, it's off limits. Number 2 is failure to encrypt patient data. Encryption is like putting your data in a safe. Only the people with the key can access it. Without encryption, electronically stored patient information can be lost or stolen. Imagine sensitive information on an encrypted laptop left in a car. If it gets stolen, all the data is at risk. Encryption is especially important for portable devices like laptops, tablets, and smartphones. So always ensure your devices are encrypted. Number 3 is proper disposal of PHI, or patient health information. Tossing patient records in the trash or deleting a file without a proper wipe doesn't cut it. Paper records should be shredded, and electronic files need to be securely erased to ensure they're gone for good. If you skip these steps, that patient data could end up in the wrong hands. Following secure disposal practices is crucial for HIPAA compliance and patient confidentiality. Number 4 is inadequate employee training. And this is one that, as private practices, can be especially complex for you. So regular training is crucial. They recommend at least once a year for existing staff and at least once upon hiring any new staff as well. If employees aren't trained properly, they're more likely to make mistakes and lead to data breaches or unauthorized disclosures. Routine training sessions keep everyone informed about the latest HIPAA requirements and help prevent unintentional slip-ups. Remember, training isn't a one-time thing. It needs to be an ongoing to be effective. Last but not least, number 5, lack of physical and technical safeguards. A lot of hospitals and clinics still have both paper records and digital records, so it is important to have safeguards for both. This includes simple things like setting strong passwords, locking doors, and using secure networks. Without these safeguards, PHI is vulnerable to unauthorized access and potential breaches. Physical safeguards like restricted access to certain areas and technical safeguards like password protection and access controls are key to keeping data safe. If you work in healthcare, these are non-negotiable. Protecting patient information is the heart of HIPAA compliance, and by avoiding these common mistakes, healthcare providers can ensure that their patients' trust remains intact. Thanks for watching. Don't forget, at Curate Systems, we help you document it, delegate it, and get it done so you can minimize risk and maximize productivity.